Hey Athena, I'm Tiffany and this is Elizabeth, and you met her a couple weeks ago. She is a physical therapist that is in Athena on Fridays every week, and she's here to talk about something really cool. So tell us what you have going on.
Okay, so these are blood flow restriction cuffs, and what they do is they create pressure and they partially restrict blood flow, and you use them with exercise. Because you're using the cuffs and restricting blood flow, you get like a buildup of metabolites and the stimulus that you need to build muscle and strength.
So who would use these, and why would they need to use them?
Okay, so there's three main purposes. One is performance for high-level athletes or people who are really pursuing athleticism. Two would be recovery. And then three, which is the main reason why I use them and they're used in physical therapy, is people with injuries. So if you can't lift heavy, you can't really get that stimulus, that metabolic stimulus and that load from lifting heavy weight because of pain or injury, or even like rest. Let's say you're in a boot, or you're not able to exercise like normal because you're restricted with weight bearing, you can use the blood flow restriction cuffs.
Yeah, so I heard about them, so earlier this year, at the beginning of the year, I tore my MCL and my meniscus, and I heard about them from somebody who comes to Athena, who is a high-level athlete, and she was using mainly the cuff to support in the atrophy of her very injured knee, so that it could basically catch up to her other leg. And so instead of using two, she was using one, and that's how I had heard of it. So you're talking about if people still want to be active and can you tell us a little bit about the process, which is really cool, like what it actually does. So I was trying to describe to someone and they were like, it's like a tourniquet. And I'm like, well, kind of, yeah. So it's like squeezing in this case, your leg, and creating pressure and cutting off a certain amount of blood flow. And you can adjust that blood flow on the cuff, right?
Yes.
Yeah. And by doing that, it stimulates the muscle in a unique way to basically induce muscle building more than you would without the cuff.
Yes.
It's really, really cool.
Yeah.
Yeah. So she was just saying, if you're injured, you can't move a ton, and you still want to train, it's like doing heavy lifting without the sheer load that you may do.
Yeah.
Yeah, it's really cool.
Yeah.
So that is something that she specializes in, and that is something that you can utilize when you come see Elizabeth. So yeah,
Awesome.
And then is there anything else that people might need to know about it? Just anything else that
I don't think so. There are some precautions and contraindications.
I was just gonna ask that. Yeah.
And so I'm trying to screen for those. So
Yeah, okay.
I always make sure every single person anywhere before using the cuffs that we've screened for precautions and contraindications.
It's very cool.
Yeah.
Okay, so if you're interested at all, you can you do consults, right?
Yes.
So you kind of consults
Yes.
to see if things are right, and then if it's something that might be, then they can work with you.
Yeah. Cool. Okay.
Yeah, it's a